Thanksgiving just 2 days away now, and the message from health experts is clear. If you travel over the holiday and you have get-togethers with people from outside your household, the consequences can be deadly. Still, millions of us are sticking to our travel plans. So if you're on the move this week, here are some things to consider. We created this map to give you a sense of where COVID's surging and maybe where you're going. It's broken down by region: Northeast, Midwest, South, and West. Over the course of this news hour, we'll drill down on each of the 4 regions, highlighting the positivity rates and giving you an overall snapshot of how COVID is affecting each region. So let's start in the Midwest. You see it there. Across the 12 states, the average positivity rate is now 22%. More than 1 in 5 tests positive for COVID. But in Iowa, it's much higher. It's half of all tests positive, 50%. Over the past week, the region's averaging nearly 900 cases per million people. That's more than any other region in the nation by far. In North Dakota, COVID killed nearly 15 people per 100,000 over the past week, the second highest daily mortality rate in all the land behind South Dakota. That's according to Johns Hopkins University. Today, the Air Force began sending in reinforcements. Dozens of nurses you see here, helping overwhelmed hospitals across the state. America's service members now helping in the front lines of the pandemic. With nurses on the ground in Bismarck, here's NBC's Gabe Gutierrez.
Shep, this is one of the hospitals in North Dakota where those Air Force nurses are working. About 60 medical personnel in all, spread throughout several hospitals throughout the state, all to help with a massive staffing shortage as cases rise dramatically here in North Dakota. Today, we saw long lines at a drive-through testing site that local public health officials use every week. They have about 1,000 tests a week. It takes about 2 to 3 hours for them to go through all of them. The problem is that it takes 5 to 7 days for those results to come back. And the public health director here in Bismarck says that's a major problem. It's because many of those tests have to be sent to out-of-state labs, dragging down the process. Now, the Air Force nurses, they're coming here to help with the staffing shortages. This hospital in particular has just 1 ICU bed. But, Shep, it's not just a question of bed space, it's the question of manpower. These Air Force nurses are now coming here. One of them had served multiple tours in Iraq and Afghanistan. He's now preparing for the war against COVID.
It's always hard, but as members of the Department of Defense, we're tasked to fight all enemies, and that's whoever and wherever they may be, including this virus.
An Air Force second lieutenant will be here through Thanksgiving, spending the holidays away from her husband.
Day in and day out, we start seeing the severity and the news, of course, and everything going on in our nation. Just proud to be here to be able to answer that call. Air Force medical teams had previously been deployed to California and Texas. They're expected to be here in North Dakota for at least a month. Shep?
Gabe, thanks. Shepard Smith here. Thanks for watching CNBC on YouTube.